If you're wondering how traditional Chinese medicine can help with endometriosis, then please watch this video. We get asked this question commonly, and today I'm going to discuss with you thoroughly how you can benefit from including traditional Chinese medicine as part of your endometriosis management plan. Before I go on into the benefits and how it can assist you, I'm going to explain endometriosis in the most simplest terms so that you can understand what it is that we're dealing with in the first place. First of all, endometriosis is the presence of endometrial lining that comes from the inside the uterus, but it's present on the outside of the uterus or around other organs. For example, around the ovary or within the ovary, around bowels, on the diaphragm, can even be on the lungs. Endometrial lining in endometriosis can be found anywhere within the body outside of the uterus. And it acts exactly like endometrial lining would when it's triggered by a hormonal change in the body. So it still has the ability to bleed. It still has the ability to try and shed and get inflamed. So unfortunately, with the presence of this tissue outside of the uterus, it doesn't have an outlet. It gets to be retained in the body, and it creates quite a disturbed environment and disrupts the tissue that it surrounds. For example, if it's on the ovary, it could pull the ovary in a different direction. It could pull on the bowel if it's present there. It could really cause other dysfunctions, structural dysfunctions to the body and affect processes in the body via its inflammatory effects. The other thing is that because it doesn't have an outlet, there's greater chance of it creating scar tissue and causing long-term side effects and creating lack of movement and freedom of these tissues in the body. And unfortunately, this could be quite detrimental for having normal bowel motions or normal physical responses in the body. All in all, endometriosis is very uncomfortable. In other cases, very, very painful, and is overall considered a chronic illness. Why does it come? People and medical profession still doesn't fully understand why endometriosis appears in the body, but we do know that it is an inflammatory response. And we do know that it moves around, it can change, and even if it's surgically treated, it can come back, and it can come back in different locations in the body. So, how do we deal with that, and how do we provide an alternative avenue for its management? Note, I'm not saying cure, I'm not saying elimination, but I am saying management, because it is something that's not well understood yet, but we can only go by clinical results, and that is the crux of my video. So let's discuss some of the symptoms that endometriosis could present with. Symptom number 1 is hot and painful. It can send referred pain to different parts of the body, like we discussed bowels, we discussed diaphragm, where it could cause nerve endings to be stimulated and physical symptoms to appear like nausea, pain, bloating, constipation. The other aspect of endometriosis is very reactive. So if something is altering your hormonal balance, for example, stress or toxicity or dietary changes, it will respond to that just as endometrial lining would in your uterus. So it can get inflamed and it can respond to your lifestyle and dietary factors and things coming into your body just as it would within the uterus. It can multiply and spread. It can be in multiple locations at the same time. It can restrict the tissue and feel quite tight, and it could prevent processes like ovulation. It could prevent bowel motion and proper breathing and overall digestive processes. It disrupts normal function of the body. When endometriosis is looked at in a surgical environment, it is sort of like glue. It's very sticky. It's blood fields. It is a tissue that sticks to areas around it and fascia around it, and it's really difficult to eliminate because it doesn't have an outlet. So when we look at Chinese medicine, how do we view these symptoms and signs and the presentation in the body? First of all, let's look at pain. In Chinese medicine, we would call it heat or inflammation. So the fact that it is a blood substance, we say blood heat. So the toxicity is in the blood level and it's on the deeper level of the body. The fact that it doesn't have an outlet gives us this sense that it is stuck. And so the term that we use in Chinese medicine is blood stagnation. Literally, it's caught, it's pulled, and it doesn't have anywhere to go. The fact that it spreads around the body, it can be in clusters, or it can be in multiple locations. Something that we refer to in Chinese medicine as a pattern, we would say wind is present when it's in different locations and it's ever changing. It could go down, it could flare. So there is a change in it. So there is a wind aspect to this condition. And the stickiness and the fact that it really anchors itself down into a tissue, it has that sticky quality. It refers, in Chinese medicine, we refer to it as damp heat, swamp-like conditions. It's hard to get rid of and it likes to hang around. If this is helpful so far, please give me an indication that you are finding this video helpful and useful. I'd love to see an emoji or a like or a comment in terms of how we're going so far in terms of understanding the condition. To help you out further, I'm just going to give you the best analogy that I've got. I love analogies, and I had to really think hard in terms of what sort of presentation it is in the body, what you can imagine is going on in the body. And what we came up with is boiling up a hot sauce, tomato sauce on the stove. So really we want the tomato sauce inside the pot, boiling away, reducing, getting ready for dinner. But what's happened is the sauce has been overboiled and it's splashed, but the cooking is still continuing even though it's splashed outside the pot. You might have stuck on the wall, you might have stuck on the stove or on the bench. It's still boiling and bubbling away in those locations. Imagine it's, the heat stays with it somehow, okay? So it's just still bubbling away and eroding the surfaces that it's on. It's affecting them. And the only way to really make sure that it's gone is to either scrape it off that surface or clean it up with a really strong spray, right? In real life, the surgical aspects are either burning away the endometrial tissue or extracting it, it's actually cutting it out. It is quite an invasive process. It can slow the progress of this spread or inflammatory response down, but it's no guarantee, and it is still likely to come back down track, but it is one of the best ways known to the medical world to manage. However, in the Chinese medicine world, we know some other tools that can help you manage this condition. In fact, acupuncture, we go on and on about how it is fantastic for inflammatory responses, and that is point number one. It is great for disrupting scar tissue and renewing tissue on the inside and promoting circulation, stagnant blood, so that gets dispersed and reduced. So that is one point of call when it comes to endometriosis. The second point of call, and it's greatly recommended, is traditional Chinese medicine or traditional Chinese herbal medicine. And the fact that the different herbs have different properties to go to different locations is gold. It is absolute relief knowing that we can tell the medicine where to go in the body. Okay, so if we know the location of endometriosis, we can guide the herbs to go to that location. We have different herbs with different properties to match the presentation of this condition. So we have herbs that slow down the spread and can address the wind aspect of, the condition that spreads through the body. We have herbs that cool the blood and create that detoxification of the blood, taking the toxins out of the blood, cooling the blood down, reducing inflammation. We have herbs that promote, invigorate blood flow so that it doesn't stagnate, doesn't become old blood and cause scar tissue, or could be post-surgery maintenance where we renew the tissue so the scarring doesn't remain there. And of course, we've got herbs that work on the gut and eliminate dampness in the body, that stickiness, and create a cleansing effect through the bowels and help reduce the pressure of that environment that is sticky and non-conducive to healing and rejuvenation. So the all-in-all recommendation would be coupling acupuncture and Chinese herbal medicine together and creating the best possible relief and management for internal health whilst battling with endometriosis. I love knowing that this option exists, whether it's alongside medical recommendations and procedures or on its own when the case is not as severe or caught in early stages. Absolutely, I always recommend to do a physical initial assessment in clinic and really identify what is going on for you specifically. This is the condition where it is highly recommended to screen it, starting with ultrasound, and get as much information as you need to find out what's going on in your body, especially if you have ongoing pain around your cycle. It doesn't matter where it is, but if there is a pattern to do with the changes of your hormones, whether it's around ovulation or around menstruation, you need to dig deeper and rule out this condition so that you can find relief and manage it as early as possible and prevent further spread. I trust that I have answered your questions. I know that women in clinic are receiving great benefit for this and great relief. So you are not alone. Please reach out and do not wait any longer. Menstrual pain anywhere in the body is not normal, and you do not have to be bearing it or living with it. You can ask for help. Thank you so much for watching. We look forward to helping you. Send us a DM if you have any questions.